purpose of my research and the scoping review, as well as the research question that kind of guided the process, was to provide a synthesis of the literature to try and describe the benefits and potential harms of screening older North American men for abdominal aortic aneurysm. And in our paper, we defined older adult men as 65 or older. And the research question that guided our process was, what are the benefits and potential harms of screening older adult men for AAA? So the purpose and the research question go very hand in hand there. The two main benefits that we found for screening older adult men for AAA were reduced mortality, and cost effectiveness for screening. And the reduced mortality is basically comes from detecting AAAs and being able to repair them before they rupture, which is often fatal. And the cost effectiveness comes from being able to repair AAAs on an elective basis versus an emergent basis. And this can be associated with shorter hospital stays, which in turn reduces overall cost on the healthcare system. The main potential harms that we found were actually lack of mortality benefits, which is the opposite of the benefit I just listed. And this is because we found some conflicting information in the literature, as well as inconsistent application of the screening recommendations. So going further into that, some of the literature also talked about how screening for AAA can negatively affect quality of life for a lot of men, which was an important finding that we elaborated more on in our discussion. And within our finding of inconsistent application of guidelines, such as inappropriate screening, so screening men before the age of 65, for example, or lack of follow-up surveillance once a AAA is detected on screening. We were able to allude to the fact that this may reduce the overall cost effectiveness of AAA screening when the screening is not used appropriately or applied according to guidelines.
And by consistent application, is that like within the country itself with an overarching guideline, or is this by like hospital or other clinic programs that offer the screening?
A lot of screening guidelines are set out by a nation's preventive health task force. So for example, we have the Canadian Task Force on Preventive Health, and our guidelines recommend screening all older adult men over the age of 65 for AAA once in their life. And this may be different from certain European guidelines or American guidelines. For example, Sweden has a AAA screening program. So according to their guidelines, they will actually reach out to the civilians and the men that are within their guideline criteria to go for our AAA screening, whereas we don't have that type of thing here in Canada. We were able to obtain literature and data from around the world, especially from Sweden, where they have an amazing AAA screening program. So, it was amazing to have that type of information and literature intertwined into our paper. Also, I believe that we were able to offer a strong discussion based on our findings to help guide primary care providers in North America, where perhaps AAA screening practices may be a little bit weaker compared to our colleagues in Europe, for example.
That does lead me to another question in terms of what are some learnings from Sweden with respect to their AAA screening program that the Canada guidelines and program implementation can take in that?
So I think Canada does a really good job with healthcare, first of all, because it's publicly funded, like a lot of countries in Europe are. And we do a good job here in Canada on certain screening practices, such as breast cancer screening, colorectal cancer screening, cervical cancer screening. A lot of these screening programs have campaigns behind them as well. So not only are healthcare providers and primary care providers aware and knowledgeable about these screening programs, but also the lay population and the civilians are also aware because of the campaigns that are on TV or the radio or social media. My understanding is that Sweden has a strong AAA screening program, because they submit letters in the mail to their residents, to men that meet the criteria. Off the top of my head, I believe they also screen men over the age of 65. So on their 65th birthday, rather, they receive a letter in the mail to tell them to book their ultrasound for screening. So, I'm not sure if we're there yet for a national screening program like that in Canada, but I would definitely support it if there was push or interest to do so.